Lots of comments on the question of should we be using IV extension sets because they reduce rates of flow through the IV. My take is that if you have a lot of volume that you want to rapidly infuse, then you probably don't want to use an extension set because they do indeed slow flow down as much as 75% when using blood tubing. And of course, you don't want to flow large bore tubing into a micro bore extension set because of that whole Poiseuille's law thing. But it's not necessarily the tubing of the extension set that presents the flow restriction. It's the needleless lure lock. To highlight how much these lure locks can slow things down, one study showed a 29 to 85% reduction in flow rates. But the reduction in flow rate appears to only be a thing when you are using large bore IV catheters. 16 gauge or greater has the greatest flow reduction. 18 gauge probably has some flow reduction, but probably neither here nor there for most patients. But they go as far to say that in smaller IV catheters, less than 18 gauge, which, let's be honest, we use on the vast majority of our everyday patients, that the flow reduction is insignificant when using an extension set. What do I take away from this? If I have a crash hypotensive resus and I need to give a lot of volume rapidly, hopefully not isotonic crystalloid, then no pun intended, screw the extension set. Everyone else, I'm going to continue to use an extension set because I think it makes life easier for everyone. And I'm all about logistics and efficiency.